I'm going to speak to you briefly about oxygen therapy and lung cancer. One, oxygen does not cure cancer. It's a treatment to relieve the breathlessness or the shortness of breath that lung cancer can cause, especially when the person is upon exertion and lying down. Many times lying on their back, they become very short-winded, or when they are exerted. Some of the ways that you can treat with the O2 or oxygen therapy is a concentrator, which is an electrical means that looks like a box with a flow meter on it that has sieve beds inside that takes the nitrogen out of the air and puts it into oxygen. So it makes oxygen, and that way you connect a cannula to it, and the person puts the cannula in their nose, and they breathe oxygen. Small tanks are also used so they can be portable, and they can go wherever the patient needs to go. You can have a shoulder harness to carry with you. Some of these tanks, especially the small tanks that you can push around a cart, last about 5 hours, and the smaller ones last about 2 hours if they're completely filled at 2,200 pounds per square inch. There's also liquid oxygen that will help, and that can be refillable at home. Often oxygen levels in the blood of the cancer patient is not really low initially, but in chronic lung disease, however, as you would know that it is. But many times a cancer of the lung will not qualify for oxygen, sometimes in a doctor's office. And that seems startling, I guess, but many times initially the patient does not present well with low oxygen levels when you test them, except on exertion or when they're lying flat. So you have to have knowledge of what you're looking for when a patient has to be qualified to be able to use oxygen when they have a lung cancer diagnosis. So it's going to take someone with knowledge, preferably a pulmonologist or your medical doctor, and a respiratory therapist that has worked with patients for a while to know how to qualify a patient with lung cancer. And you say, well, why do I need to be qualified? Because insurances ask for certain numbers, and you have to know what positions this lung cancer patient presents with the lowest numbers.